In regards to ZUMA-2 trial, there are a lot of things that are really important to know. One is that this trial really took on a very, very high-risk group of patients. The eligibility required that patients be either BTK intolerant or refractory. And so that means there are patients who came onto the trial who didn't respond at all to the BTK. There are some who came on that relapsed within a short time or potentially a long time of being on the BTK. But as others have heard me talk about in the past, when we see that BTK relapse or BTK refractory patient, they're usually very proliferative, they're usually very aggressive and very difficult to rescue. And that was also seen on this trial when we look at the Ki-67. The Ki-67 was greater than 50% in a large percentage of these patients. We were also seeing TP53 mutations in a high proportion of patients who were enrolled on this trial, typical population, and also captures all the things that we hate most about mantle cell lymphoma. You know, these are all the same things that make treatment with any drug, whether it be Revlimid, whether it be Velcade, whether it be you name it. You combine that TP53 mutation status with you know, highly proliferative disease, and we struggle. We really struggle. And so I think you know, the fact that that Kite Pharmaceuticals, Gilead Pharmaceuticals chose to invest in this space was a very meaningful step forward, not just because they were willing to do it, because it worked. So what do I mean by it worked? They treated this subgroup of patients with a cell dose of around 2 times 10 to the 6 cells per kilo, and with this dose, they were able to show a 93% overall response rate. The majority, about 2/3 of which were complete remissions. This is hitting it out of the park as far as I'm concerned. You know, this is again a space where we're lucky to see, you know, anything, let alone you know, complete remissions. You know, I think adding to the response rates, we also now have the published durability of response, which when we look at it at 1 year and even as far out as 2 years, the curve seems to be plateauing right around 60%. So that means we're not only getting a high efficacy, we're seeing that these responses are durable over time. Again, I've not seen anything like this in this population of mantle cell lymphoma. So I'm very, very encouraged by the data.